Okay, good morning. Today, in this video, we will demonstrate foot ankle strengthening exercises designed especially for diabetic patients, especially for peripheral diabetic neuropathy. These exercises is evidence-based and aim to improve foot ankle strengthening, mobility, joint, and overall function. So, before begin the exercises, we need to ask the patient whether he has any open wound, active foot ulcer, and any severe pain. Do you have any severe pain?
No.
So no ulcers and no open wound. So we clear. Next, we need to make sure the patient is wearing appropriate footwear and they have a support such as wall and also the chair. And lastly, we need to make sure the exercise area is free from obstacle, flat and dry to make sure the safety. The first exercises is warm-up walk. This exercise increase blood circulation and prepare the foot and ankle joint for movement. We only need supportive shoes and flat walking surface. First, we demonstrate to them and we ensure the walkway is flat, dry and obstacle free. And then after we demonstrate to the patient, we ask the patient to stand upright with feet shoulder width apart and then begin with the walking at a slow and comfortable pace. We encourage them to a natural heel to toe walking pattern and then we observe gait, balance and foot placement. After 2 to 3 minutes, slightly increase walking speed if tolerated and continue for a total of 5 minutes. Stop if the patient feels unstable or dizzy. Inspect the feet afterward, especially in patients with neuropathy. After the exercise, we ask them if they are having any severe pain. The next exercises named towel curl. So this exercise strengthens the intrinsic foot muscles, which are often weak in diabetic patients. The only equipment is small towel and chair. So, first we demonstrate to them how to do this exercise. And then we instruct them to sit comfortably with feet flat on the floor. And then place a towel under one foot and keep the heel on the floor at all times. Next, we instruct the patient to curl the toes to grip and pull the towel. Relax and repeat until the towel is fully scrunched. Perform 2 to 3 rounds per foot. Avoid if they are active foot ulcer or they feel severe pain. This exercise helps to improve toe control and increase foot strength and reduce plantar pressure.
So we go to the toe spreading exercise, which is this exercise focuses on activating the intrinsic muscle of the foot and also improving the toe coordination, which is important for foot stability and balance. Firstly, we need to explain the procedure or step to do this exercise correctly. The exercise can be done by sitting or standing. If the patient are choosing to sit, then we need to demo in sitting position. Then show and teach them how to spread the toe and back to normal position by repeating do this step and change to the other foot. After that, we need to ask the patient to sit comfortably using a chair or support if needed. Make sure the foot is relaxed and placed flat on the floor. Then next, we need to instruct the patient to slowly spread all the toes apart by trying to create a space between each toe. This movement should be gentle and controlled without forcing the toes. And then once the toes are spread, hold the position for about 3 to 5 seconds. Encourage the patient to breathe normally during the hold. And then after that, we need to ask the patient to relax the toes completely and return to the starting position. And then repeat this movement for 10 times. If patient experience any cramping, they can gently shake the foot to relax the muscle before continue. Okay, next we are going to do calf raise exercise. I will show it first and demonstrate about the procedure of doing calf raise. And you need to make sure the patient listen and look at the correct way. And then first thing first, we need to make sure patient stand straight, and then while hand placed onto support things which help them in balancing their body, and place their feet wide apart. We need to let the patient do the movement by monitor them and make sure movement are being controlled and steady. Slowly to lift both of heel off the floor, coming up onto his toes, and hold for 2 seconds before back to started position, and repeat for 10 to 15 times for 3 sets, or depends on patient ability. The exercise can be progressed by reducing hand support, but for safety ensure that balance support is always available. Lastly, we need to make sure or ask if patient had cramping, and then we need to know about the patient condition after exercise to get a feedback.
Next exercise is ankle resistant band exercise. For this exercise, we need a resistant band. This exercise is to strengthen ankle muscle in all directions. To perform this exercise, we need to secure the resistant band around the foot, and then start perform plantar flexion by point toes forward against the resistance. The dorsiflexion by pulls toes outward towards the shin. And then inversion by turn the sole of the foot inward against resistance. And for the eversion by turn the sole outward against the resistance. You need to perform this exercise for 10 repetitions in each direction. And then you need to avoid excessive resistance. Ensure the band is securely anchored to prevent recoil injury. Next is ankle alphabet. This exercise is to improve ankle mobility and coordination. To perform this exercise, the patient must sit on a chair or on a bed with one leg slightly elevated off the floor. Move foot to draw each letter of the alphabet in the air using a big toe. Keep the movement slow and controlled. The ankle should lead the motion and complete the A to Z and then rest. The repetition should be 1 to 2 rounds per foot. The patient can stop if fatigue or pain occurs.
Next, we move on to passive dorsiflexion. First, patient should be seated with leg extended. They can use towel to cover their ball of their foot. So we can start gently pull their foot towards them until they feel the stretch in the calf muscle. So they can do 10 to 15 seconds. While doing this, we feel pain sharpen, we can avoid that. After that, we can do passive plantar flexion. Same goes here, we have to hold for 10 to 15 seconds. So next we move on to active movement. So in this case, they have to do without assistance. Same thing they have to do. From neutral position, they have to pull their toe to them. So they can do 10 to 15 reps. And they can do for 2 to 3 sets as well. After the dorsiflexion, they have to do plantar flexion as well. While doing this exercise, they have to avoid bouncing movement if got sharp pain. They have to stop to prevent injury. Next, we move on to single leg stance exercise. First, patient should be sit. From sit, they have to stand near a chair or wall for safety. After that, they have to shift their weight on one side and lift their leg slowly from the ground. After that, They have to keep their eye forward and maintain upright posture. They can do for 10 to 20 seconds while keeping the standing knee slightly bent. And lower the foot and repeat this to 2 to 3 sets for each leg. And while doing this, patients should stand to support if their balance is poor, and you have to avoid unstable surface for patients with severe neuropathy. So progression for this exercise, they can use close their eyes while doing the same thing, or stand or folded towel, or either they can lift their arm overhead while doing the same thing. Same thing, 10 to 15 seconds each leg they have to do. So that's all for single leg stand.